Overture Solutions, a leader in secure document printing and a privileged partner in digital transformation, is proud to bring its official support to the group of SIDS Leaders Conference.
Excellencies, ministers, honoured officials from the international agencies, ladies and gentlemen, a very warm welcome to this second meeting of the Group of Small Island Developing States Leaders, otherwise known as SIDS. My name is Juliet Foster, and I'll be guiding you through 90 minutes of lively and what I'm sure will be thought-provoking debate on the theme of pandemics, prevention and preparedness. Now, this event builds on the success of the first SIDS leaders meeting, which took place in early May. And at that time, we explored the impact of the Cotonou Trade Agreement on small islands. Now, as the international community begins to build a future beyond COVID-19, small island developing states are demanding a voice in contributing to and indeed benefiting from the process. But it has to start with addressing the distribution of vaccines to the largely vulnerable community of some 38 sovereign small islands across the globe. Now, to put this in perspective, a recent policy brief by the United Nations Department of Economic and Social Affairs reported that the number of COVID-19 related deaths per 100,000 people was actually higher in SIDS compared to other developing country groups and regions, and I'm including within that LDCs and LLDCs. So from the UN to the World Bank, from the EU to the various NGOs, the pandemic is seen as having not only magnified the vulnerabilities of SIDS, but has also faced them with stark choices that have the potential to cause long-term economic and social damage. A 2020 UNCTAD report found that SIDS experienced a GDP fall of 9% compared to a 3.3% decline in other developing countries. At the same time, only 6% of COVID-19 related spending for developing countries was spent on small island developing states. That's an increase of 2% from August 2020. Well, the result of this is that COVID-19 is stretching national budgets to breaking point, with SIDS having to choose between paying off external debts or preparing for another pandemic or even the next tropical storm. Well, as SIDS struggle to repair their public balance sheet, extra funds will be required to finance the immediate health response to lead the way to economic recovery once the pandemic itself is brought under control. It's fair to say that this is a truly massive task for small island developing states who rely on commodity exports, tourism, and indeed other services. So today we're going to explore whether the international community and transnational organisations recognise the enormity of the challenge and whether we're doing enough to help. And what about the vaccine programme? COVAX, the body responsible for making vaccines globally available, has approved another $775 million to fund the delivery of the COVID-19 jab to lower income countries over the next 2 years. Does it go far enough? And how much of a difference will it make realistically? Well, to debate these issues, I'm delighted to say that we have a distinguished panel of experts. They each have an allocated amount of time to give a speech outlining their position, after which they will be asked further questions. And I'd like to stress at that time that it is important for all of you to stick to the amount of time that you have been given, as there is quite a lot of ground that we have to cover in the time available. Also as well, if you could mute your microphones when you're not using them, that would also be very helpful. Now, before we hear those speeches, I would like to call to the floor the co-founder of this SIDS group, His Excellency David Doyle. He is the ambassador of St. Kitts and Nevis, and he's going to share his opening thoughts and indeed some warm words of welcome. So, Excellency, the floor is now yours.
Thank you, Juliet. Excellencies, distinguished guests, welcome to this Global SIDS Leaders event devoted to pandemics and its implications for small island developing states. Now, this is the second such event which brings together leading experts from the European Commission, the UN family of organizations, multilateral and bilateral organizations, along with senior ministers from the small islands to debate critical strategic issues about the future stability of this particular community. SIDS makes up something like 38 sovereign states scattered across the globe, from the Caribbean to the Pacific, from the Atlantic Ocean to the Indian Ocean, representing some 20% of the UN membership. It was with a view to giving these particular small islands a more assertive voice at transnational level that the GSL was initiated by the governments of St. Kitts and Nevis, the Solomon Islands, Dominican Republic, and the Seychelles earlier this year to fulfill this ambition. The GSL platform enables these small islands to articulate their strategic vision at transnational level on strategic issues such as the one we're going to discuss today, a damaging pandemic and inflicting huge economic hardship on islands with limited institutional capacity to respond. In collaboration with my co-founding partner, Ambassador Jean-Paul Carteron from the Solomon Islands, we will be rolling out future GSL thematic debates in the next couple of months on social, economic and financial policy areas affecting SIDS. But let me leave you with one simple thought. Despite representing 20% of the UN membership, the remoteness of these small island developing states, their size, their limited institutional capacity, means that sometimes they struggle to get their voice heard at bilateral and multilateral fora. So ultimately, the GSL initiative seeks to inscribe SIDS' strengths, weaknesses, opportunities, and threats at the heart of the global development agenda, and allows SIDS to become an integral part of the solutions to the big issues that we are trying to tackle globally at the moment, whether it be climate change or combating this pandemic. Allow me in conclusion to thank the sponsors of today's event, Aubetoir Fiduciaire, and its president, Nicolas Koudros. Enjoy the event. Thank you.
Ambassador Dolma, thank you so much for that. I'd now like to hand the floor to Dr. Sylvie Briand, who is the head of Pandemic and Epidemic Department at the World Health Organization. Now, Dr. Briand led the Global Influenza Program during the 2009 swine flu pandemic, and she was also responsible for launching the WHO Information Network for Epidemics, the aim of which is to counter misinformation about coronavirus. So, Dr. Briand, it's good to see you. The floor is now yours, and you have 5 minutes. 5 minutes.
Okay, thank you very much, Juliette, and excellencies and distinguished guests, ladies and gentlemen. I'm very pleased to be with you today, and I would like to thank the organizers of this meeting, and in particular the Crans-Montana Forum and Jean-Paul Carteron for the invitation. Actually, we all know that this pandemic has been a tragedy, and unfortunately, it's not over. And the impact has been particularly enormous on developing countries and SIDS. The impact has been first on health, and because you know that there is an enormous amount of cases and deaths, but also the impact has been on health systems. First, because many health workers were victims of the COVID-19 disease. Actually, in 2020, October 2020, we had 7% of the cases were in health workforce. And so it's very important because in some countries, really the health workers are in limited number. And so when some of them become ill or even die, I mean, it's really a loss for the health system. And also because while the health system is dealing with COVID-19, they cannot attend other diseases. And in particular, routine vaccination program have been particularly impacted during this pandemic. And so we know now that there are cohorts of children that are not protected against other epidemic disease. So it's a real concern. At the same time, as Minister Brandley said, there was an enormous impact also on societies and economies, and in particular in developing countries and in SIDS. And this impact will go beyond this pandemic as well, because the recovery will last longer. And so we need to pay particular attention at this recovery period and support those countries to recover more promptly and being better prepared for next events, because we know that at global level, the risk of pandemics and epidemics is increasing. Fortunately, we have more tools to deal with them, but still, the risk is increasing, and so we need really to be cognizant that we need to get better prepared and be ready for next emergence of new disease. So the problem for most of the developing countries is that while they are still struggling with COVID-19, they also have to deal with other epidemics, because the other causes of increase in patient in hospital have not decreased. We still have cholera outbreaks, yellow fever outbreaks, dengue outbreaks, and many other outbreaks are still ongoing. And so it's very important to understand that the burden on certain countries, it's really enormous. And this is why the international community needs to join forces and support those countries who are particularly vulnerable. So being an island, sometimes it's an opportunity, because with regard to epidemics, you can, of course, close your border and prevent the virus from entering the country. But as Minister Brandley said, it's also a double-edged sword, because at the same time you prevent tourism, and so the impact on your economy can be really high. But also, being an island, it's a lot of challenges, in particular with access to commodities, and it's not only vaccine, but we have seen also it can be a problem to access oxygens, personal protective equipment, and many other communities, like diagnostic tests that are absolutely essential to deal with the pandemic disease. So we see that there are particular vulnerabilities in seeds, and that's why it deserves a particular treatment as well. And we need to be particularly also cautious when we develop global plans to support developing countries, to not forget seeds and their particular needs that are different. Where are we now? As you know, the virus, unfortunately, is evolving, and we see that new variants are emerging. And so the last one, the Delta variant, is particularly challenging, because the transmissibility is higher. When we see a new variant, we look at 5 things. First, is it more transmissible? Is this variant more virulent? And what is the impact on the variant on diagnostic, therapeutics, and vaccine? So although the Delta variant is more transmissible, fortunately so far, we don't see an increased virulence in this variant. And the impact on vaccine, diagnostic, and therapeutic, so far it's moderate, meaning that the existing vaccines are still working very well on this variant. And that's why it's very important to have the vaccination strategy should really target in priority, especially when the vaccines are scarce, the people with more likelihood to have a severe disease and getting hospitalized, because those people will benefit a lot from the vaccine, as most of the vaccine currently are protecting from severe disease and hospitalization. And those people are, of course, the elderly, but also the people with underlying conditions such as diabetes, cancer, immunosuppression, and cardiovascular disease, for instance. So targeting vaccine towards the most vulnerable group, at-risk group, is very important. And of course, it's important to protect health workforce as well, by first providing them protective equipment, but also vaccinating them in priority, so that they can continue to support the increasing number of patients coming with COVID-19. And finally, I would like to highlight the issue of misinformation. Actually, we call this at WHO the infodemic, which is not only misinformation, but it's just the increase of information during an outbreak. Some of this information is accurate, other information is not accurate, but the result is that people don't know who to believe and how to translate this information into behavior that will protect their health and the health of their communities. So this tsunami of information, this infodemic during epidemic, is not a new phenomenon. We see this with every epidemic, whether it's Ebola, yellow fever, cholera, we always see an infodemic. But this time, with this COVID-19 pandemic, it has been particularly severe because of 2 things. First, it's a global event. So, and as internet is connecting us throughout the planet, everybody has access to loads of information. And so it's even more difficult to understand what is happening. But second thing also is that because people now are connected through social media platform, they are more vulnerable also to misinformation. And so that's why at WHO we take this very seriously, and we encourage our member states to do the same and have specific strategies to manage the infodemic, which is on one hand provide good information to the population, but also listen to population concerns so that the information that is provided answers their concern in priority. And you can also debunk misinformation as soon as it appears and reassure people in a timely manner. And finally, we also encourage member states to empower community, engage with communities, because communities are also the solution to the disease transmission, and they need to be at the forefront at the same level with health system, healthcare workers, and national authorities. So with this, I will stop because the time is short, but many thanks for this invitation.
And many thanks to you, Dr. Briand, for that excellent presentation. You actually preempted a question I wanted to put to you about the impact of misinformation to these small island developing states, but you have addressed that question beautifully, and thank you so much for that, and also for making the time, because I know that you too must leave us, but thank you so much for your contribution. All I can say now is have a wonderful afternoon, what remains of it, and I hope to see you again very, very soon. And to all of you, please stay safe.
Overture Solutions, leader in secure document printing and a privileged partner in digital transformation, was proud to bring its official support to the group of SIDS Leaders Conference.